My name is Jesse. I'm a chiropractor and I practice at Square One Active Recovery. This is a practice I started when I moved back to Singapore for about maybe 4 years ago. And I've been practicing just here for all my entire time in Singapore. Before this, I was in Australia and I mostly worked with athletes, so mostly high-level athletes, and didn't really practice at a specific place. So I moved around between clubs and things like that. So when we look at risk of back pain, that's really hard to answer because on average, maybe 80 to 90% of people would have back pain. So pretty much it's more like maybe who is protected from back pain. Things like working from home and ergonomic type stuff, we don't really see them as causes of back pain at this stage. We see them as more of aggravating factors. So you probably would already have back pain and sitting on a terrible chair would make it worse. Rather than you don't have back pain and you use a terrible chair and the chair actually gave you back pain. That's something that I think is also quite interesting to understand as far as risk is concerned. A lot of people think of risk as causes of back pain, but for most parts of it, those things that we think of as causes are actually more aggravating factors. So we can think like, let's say, if you go for a run and you have back pain, usually it's not because running caused your back pain, but because your back is in a certain state and running just aggravated. And similarly, when we start to think of people with like poor posture and who tend to have pain when they slouch a bit more, usually it's more because the posture aggravates their pain rather than that the posture caused their back pain. For causes of back pain, usually we'll have to look at whether it's acute or chronic. So acute will be anything that's less than 12 weeks, or we'll consider acute or subacute. When we move towards chronic pain, we don't see that there is a strong physical contributor to it anymore. The current understanding of chronic back pain is more of a biopsychosocial sort of approach. We see that people's pain are heavily influenced by their social situation, so family life, marriage, friends, things like that, or maybe even work environment. We also see that it's heavily affected by their psychosocial well-being, so how stressed they are, their state of anxiety, whether they're happy or not. For acute, we understand that a bit better. So usually there is some sort of traumatic incident. It doesn't have to be very serious. Could be just maybe trying to avoid something, and just kind of turn a bit. Like getting out of the car, you could sprain yourself, and those are more common in acute type cases. We see that people with acute back pain that receive very poor care tend to more likely transition to chronic. So let's say if you just maybe sprain your back at the gym, and if you go for treatments that are not evidence-based, the likelihood of you having back pain that will transition to become chronic is 5 times more. That's not to say that the tissue injury doesn't heal. The tissue injury actually heals, but the pain persists even though the tissue recovery has completely occurred. Yeah. For low back pain, when it's severe enough for people to seek medical attention, we usually look for other symptoms. So let's say if you have significant changes in weight over the last 3 or 6 months, or maybe if you have fever, recurrent fever. Sometimes people get back pain at night, so we call it like night pain, and that's also could potentially be quite serious. The most concerned part of additional symptom on top of back pain that you have is probably when you start to lose bladder function or bowel function. So usually that you just have to go to the hospital immediately. But technically, back pain on its own, outside of those situations that I mentioned earlier, cannot actually kill you. It can be really, really bad, but just more of a quality of life, well-being, productivity, social well-being point of view. So usually if you have any of those symptoms that I mentioned earlier, we would recommend that you go to the hospital. If it's not, then we will probably make further recommendations if you're not at all responsive to conservative care. So that usually suggests that there is something else going on top of your pain that we're just not able to identify or treat, and then we'll make recommendations. for people with back pain, when they first come, we usually have a chat with them to see the extent of their problem. And we really want to understand how their back pain behaves. A lot of times when people look for pain treatments, they don't really factor in the lifestyle component. So let's say if we were to treat someone with back pain from sitting at a computer for like 8 hours a day, most likely that person's treatment will be super different from someone who say play tennis for a living. So they can both have the exact same type of back pain in terms of how it feels and when it happens, but the angle is really different, and therefore the way we work with them will be quite different. So most of the time, the first thing that we would really want to establish is the history of their back pain, how it has been, the patterns, whether there's anything that we can identify. After that, we want to know what's their endpoint, where do we need to get them to be. Once that's done, we can start to work on more assessment-related type situation to see what makes the pain worse, what makes the pain better, if there's anything that we should be concerned about. And we'll usually do exercises with all of it as well. For people with back pain, we use a lot of exercise-related sort of treatment because the premise of our practice is that people should be able to help themselves. In a lot of times, we see that people with back pain and they seek other treatments, they usually need to see someone to make the pain go away. So let's say if you see a more traditional chiropractor, you go to them, they'll give you adjustment and you feel better. But the next time you have back pain, you have to go back to them again. So we really wanted to move away from that. We wanted to move towards a more self-sufficient, a more empowered type of recovery model. So we have quite a bit of exercise equipment, and the reason we do that is for those reasons. And the different type of equipment would be based on what the end goal is. So let's say if the end goal is to run a marathon, then we would have a certain type of equipment that we use for that. Whereas if their end goal is to say be able to sit at a chair for 8 hours through the workday, then we may go for more endurance type of stuff, increasing their sitting capacity type of exercises. Yeah. If you want to relieve back pain at home, probably the fastest and the cheapest way to do it would be heat pack. If you're thinking of something maybe more long-term, you might want to do some home exercises that will help. That usually doesn't provide immediate relief, but over long term, you'll see more results. Yeah, I would say in terms of home-related stuff, heat pack and some exercises are probably the best thing that a person can do for themselves. If they're looking for more longer-term sort of results, where they want to see their back pain not coming back again, then that's probably when they need extra help, someone to actually be able to figure out what exactly they need to do that would help them in the long term.
Don't forget to like, comment, and subscribe for your regular dose of Asian health information.